Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today I'm going to talk about nurse practitioner credentialing delays and then resulting gaps in their pay, and I'll explain what I'm talking about. So when you join a new practice for any nurse practitioner, they have to get you credentialed with insurance companies. And so they have to submit applications to each insurance provider that they accept. And then the insurance company will then, do their processing, background checks, all that good stuff. And then once you are on the panel and able to bill for your services with that insurance company, then you're good to go and you can see patients who have that insurance. One of the issues that arise when a NP is either switching jobs or maybe they're just finished up their schooling and are newly licensed, is it doesn't happen immediately. It normally can take somewhere between 60 to 120 days, sometimes more, to get credentialed with an insurance company. And so there's always a conundrum with the new employer of, all right, well, how valuable are you if you're not credentialed with our insurance companies? And then what are some strategies that they employ? Well, one, they could just not have you see the patients with the insurance companies that you're not credentialed with. That's one solution. It's kind of a logistical nightmare for a practice to have to then determine exactly who has what insurance and then who can see who. And so it's difficult for scheduling, and most practices don't want to do that. They could simply bill you incident to the physician, meaning the physician generally has to sign off and check the charts, and then they are the one that would bill under their MPI until you are credentialed. That's not an uncommon way of doing it. But the biggest red flag is you don't want to go into a situation where you're paid purely on production or collections when you simply can't see as many patients as you were expecting because you're not credentialed with the insurance companies yet. And ideally, you would never accept a job where you immediately start on some kind of collections-based agreement, meaning you want a guaranteed amount, either an hourly rate, a daily rate, a base salary for at least 6 months. And then if it is a collections-based agreement, or maybe you're in a hospital or a healthcare network and there's some kind of RVUs involved, it then transitions in from that guaranteed amount into the production via the collections or RVUs. Avoiding having any kind of super low volume at the beginning because you're simply not credentialed with the insurance companies is important. But even more important is having a set amount of money for the ramp up period when you join a practice. Normally I'd say it takes 12, sometimes 18 months for a practice to reach maturity. So, to get to a level that you feel confident that it's going to stay at that level. Now, obviously this depends upon the setting that you're in, whether you're taking over someone's patient panel, whether they simply have a volume need and they're going to try to build up your practice. This doesn't apply to someone who's doing like hospitalist or urgent care or ED work. This would be like if you went into a primary practice and they just say, yeah, we're getting very busy, we need somebody else. And then you're slowly building up. And so not only are you slowly building up, but if you're kind of cut out of having being able to provide care for half of their patients just because they're not credentialed, it could be, you could be paid much lower than you were expecting. So 2 things to take away. 1, make sure you get a guarantee for at least 6 months, ideally a year. And then 2, if you're not credentialed with the insurance companies, there are kind of ways around that by seeing patients who are or working incident to. However, there can be some shenanigans in some practices where everything they do is billed incident to because they make a little bit more when they're actually not incident to. They're like the physician who is billing under their MPI may not be actually doing the duties that are needed to have an incident to code. So just keep that in mind and have that be on your radar, whether the billing is, being done correctly or not. All right, that's a little bit about credentialing. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care. Bye.